If you're watching this, you're likely in your late 30s, 40s, or early 50s, and you've started noticing changes in your body that feel unfamiliar. Maybe your energy isn't what it used to be, or your cycle seems less predictable, or you wake up in the middle of the night for no clear reason. These shifts can feel confusing, even unsettling. But I want you to know something important right away. What you're experiencing is often normal. After about age 35, many women begin the natural transition called perimenopause. This is when estrogen and progesterone levels start to fluctuate more than they did in earlier years. It's not a sudden event, it's gradual, and it affects each woman differently. Today, we'll talk about 5 common signs that your hormones are changing. These are drawn from what women commonly report and what medical sources describe. The goal isn't to worry you. It's to give you clarity so you can understand your body better and know when to seek support if needed. Let's go through them one by one. Sign 1. Changes in your menstrual cycle. This is usually the first thing many women notice. Your periods might become irregular. 1 month the cycle is shorter, perhaps 24 days instead of 28. The next, it's longer, or you skip a period altogether. The flow could be heavier than usual, with more clotting, or lighter and shorter. You might have spotting between periods. These changes happen because ovulation becomes less consistent. Estrogen levels rise and fall unevenly, and progesterone doesn't balance things the way it once did. For some women, this starts in the late 30s, for others, closer to 45. If your cycles vary by more than 7 days consistently, or if bleeding becomes very heavy or lasts longer than usual, it's worth discussing with your doctor to rule out other causes. But in most cases, this is simply your body signaling the beginning of perimenopause. Sign 2. Hot flashes or night sweats. You might feel a sudden wave of heat rising through your chest, neck, and face, lasting a few minutes, sometimes with sweating or chills afterward. Or you wake up drenched at 3 a.m., even if the room isn't warm. These vasomotor symptoms are tied to fluctuating estrogen affecting your body's temperature regulation. They can happen during the day or night and often feel more intense right before or during a period. Some women have them mildly and infrequently, others find them disruptive. The good news is they don't last forever for most women. They tend to peak in late perimenopause and ease after menopause. In the meantime, simple things like layered clothing, a cool bedroom, or avoiding triggers like spicy foods or alcohol can help manage them. Sign 3. Trouble sleeping or feeling unrest. You go to bed tired, but sleep doesn't come easily. Or you fall asleep fine but wake up in the early hours and can't get back to rest. Even when you do sleep, you wake feeling like you haven't. Hormonal shifts, especially drops in estrogen and progesterone, play a big role here. Progesterone has a calming effect, and when it becomes less steady, it can affect sleep quality. Night sweats add to the problem. Over time, poor sleep can make everything else feel harder: concentration, mood, energy. If this persists, tracking your sleep patterns and creating a gentle wind-down routine can make a difference. And if it's severely affecting your days, talking to a healthcare provider about options is a reasonable step. Sign 4. Mood changes, irritability, or feeling more anxious. You might find yourself more easily frustrated, tearful, or anxious about things that didn't bother you before. Some women describe a shorter fuse or waves of low mood that come and go. Brain fog, trouble focusing or remembering small details, can tag along too. These aren't signs of weakness. Estrogen influences brain chemicals like serotonin, and when it fluctuates, mood can shift. The sleep disruption we just talked about doesn't help either. Many women feel relieved to learn this is hormonal rather than something wrong with them personally. Gentle movement, time outdoors, connecting with others, and sometimes professional support can help steady things. You're not alone in this. Sign 5. Changes in intimacy or vaginal comfort. You might notice dryness during sex, which can make things uncomfortable or even painful. Libido could feel lower, not because desire has disappeared entirely, but because the body feels different. Some women also experience more urinary urgency or occasional leakage. Lower estrogen thins and dries vaginal tissues and affects the urinary tract. This is common and treatable. Simple moisturizers, lubricants, or talking to your doctor about localized estrogen options can restore comfort for many women. There's no shame in addressing this, it's part of caring for your body through this phase. These 5 signs, irregular cycles, hot flashes or night sweats, sleep changes, mood shifts, and changes in intimacy, are among the most common ways hormones signal they're transitioning after 35. Not every woman has all of them, and the intensity varies. Some sail through with mild changes, others need more support. The key is recognizing them without fear. Your body isn't breaking, it's moving into a new chapter. Perimenopause can last several years, leading to menopause when periods have stopped for 12 months. If these changes are affecting your quality of life, please reach out to a healthcare provider who listens, whether that's your gynecologist, a women's health specialist, or someone familiar with midlife transitions. Blood tests for hormone levels aren't always definitive in perimenopause because levels fluctuate, but your symptoms matter most. You're wise to pay attention now. Knowledge reduces the unknown, and you deserve to feel informed and supported. Thank you for watching. If this resonated, consider subscribing for more calm, straightforward conversations about women's health after 35. Take good care of yourself, you've earned it. You're not alone. Talk to your doctor if needed.